Hi, my name is Jordan Costa Nicholson. This is my thoughts on the video and just the questions. So I said for number one, describe the two types of modern psychological therapies. There's two. There's insight therapies and then there's action therapies. Um, insights is basically making sure people kind of know what they're thinking, like how they feel, their emotions, and like all of that. And then yeah, it's basically just to become more self-aware, and to just know like the causes of like a lot of your issues. Action therapy, uh, kind of like changing your behaviors, and understanding them. So it's like doing both. So like not just understanding your emotions or like how you feel, but also changing them to like for like the better or for the worse sometimes. Um, Basically just trying to fix like a thinking pattern you got. Number two, what are the three therapies based on classical conditioning? There's systematic desensitization, there's aversion therapy, and then there is implosion therapy. Um, Implosion therapy is basically, I need to stop saying, exposing clients to stimuli to decrease their anxiety. Aversion therapy is basically like your behaviors that you don't like, or like doing it, I guess, or like seeing it or feeling it to like reduce the behavior. And then systematic desensitization is like kind of like just giving like little teases of anxiety, and then also like teaching people how to relax. So that's for number two. And then number three, define and list the three goals of cognitive behavioral therapy, CBT. CBT is basically therapy which focuses on like changing how you think, like your negative thoughts and all that, to basically make you feel better or improve your emotions, and how you function. The goals of that are basically to see like why you're thinking negatively, to replace those thoughts too. That's the second goal, with positive thinking thoughts instead of like negative ones. And then problem behaviors is number three. Basically just change them. So change the behaviors that come from the negative thinking. Okay, and then number four is advantages and disadvantages of group therapy. Advantages, you get people who kind of understand what you're going through, shared experiences, all that. Number two, you can learn from each other, so you can learn each other's strategies to just have better experiences. It is also cheaper than individual therapy, so that's also an advantage. The second one is disadvantages. No, you do get less attention from like a therapist, so it's not one-on-one. So they'll have to like share their thoughts and opinions, and they probably won't get to you as much as you would like them to. Two, there's gonna be people, so they're gonna hear what you're saying and like all the stuff like that you've been through, so you could get judged and things like that. Three, you could be uncomfortable, sometimes in a group setting. Like not everybody likes that, not everybody's comfortable with that. And then five categories of drugs used to treat psychological disorders: pharmacology, anxiety drugs, so basically like just to help anxiety, antidepressants, of course, to help depression, antipsychotic drugs, just to treat psychotic disorders like schizophrenia, and then mood stabilizers, to treat, like your mood swings and all that. Yeah, and that is my thoughts.